just having fun, rolling around, snow angels, and having fun in the snow.
All right. Kathy, I feel like you got cut off there. Am I the only one who got her, who is missing her sound? Okay. Kathy, Secretary Blumenfeld, thank you so much. I'm super happy to have you with us today. Appreciate that. All right. Do we have anybody from DVA here today?
Good morning. My name is Joey Hoey. I filling in. I'll be the designee from the new secretary designee James Bond over at DVA. So again, Joey Hoey. I apologize I didn't put the agency in. I'm still learning some of this Zoom meeting stuff. My favorite memory of snow days was I grew up with 4 brothers, and we would build snow forts and have snowball fights at the end of the driveway. So
I love it. Thank you. Welcome, Joey. Thank you so much for being with us. We're excited to have you here. Let's see. Oh my gosh. Boy, we are so glitchy this morning. I think our internet is really gonna give us a run for our money today. Kathy, glad to see you back. All right, let's go over to DATCP. Anybody from DATCP today? All right. How about the Child Abuse and Neglect Prevention Board? Rebecca, I think I saw you there.
Yes. Good morning. I'm Rebecca Murray, the Executive Director for the Wisconsin Child Abuse and Neglect Prevention Board. My favorite memory from snow days, either as a kid or with my kids, is sledding, because I love the snow and being outside.
Awesome. Thank you so much, Rebecca. Good to see you. Over to the Office of Children's Mental Health. Linda, I think I saw you.
Hi, good morning, everyone. I'm Linda Hall, the Director of the Office of Children's Mental Health. I'll just say that one of my memories was knocking off huge icicles off the garage and treating them as popsicles for the day.
Awesome. That
Glad to
brought
be
a
here.
smile to my face. I love it. All right, over to DHS.
Hi, I'm Curtis Cunningham. I'm representing DHS. I'm the Assistant Administrator for Benefits and Service Delivery, so oversee the coverage policy of the Medicaid program, including children's services, home and community-based services, and then how we put those services together in various programs, whether it's the long-term care program, birth to 3, or other managed care capitated programs. So happy to be here. And I would say, one of the things I liked is when you could gather up the snow and then you take maple syrup and put it in the snow and mix it up for a little ice cream or, snow cone treat. That was always a favorite of mine. So thank you.
Awesome. All right, thanks, Curtis. Welcome. Great to see you. And DPI, Yui, I think I saw you there.
Good morning, everyone. Thank you, Curtis, for sharing that. That was very risky. That's just all I'm going to say about that. Yui Win. I am the Assistant State Superintendent for the Division of Academic Excellence. I'm filling in for our wonderful leader, Dr. Underly, who is driving in this weather right now. She's on the call, but we want to make sure that she stays safe. I'm also joined by our Policy Initiative Advisor, Sarah Kanivi. My memory of snow days was really, I was born in Minnesota, I lived in Minnesota. So that meant that there was a lot of hockey and I couldn't skate very well. So there was a lot of boot hockey during those snow days. So I'm excited to be here and I'm excited for our work together. Thank you.
Great. Thank you so much for all the new folks joining us today. I want to just take a minute and remind folks why we do the Leadership Council in early years, so what our original purpose is, and also to highlight some of the work that we've done together as a group since we launched this leadership group back in February of 2020, which was just a couple weeks shy of when the world shut down, and I will never forget that. So Leadership Council on Early Years was envisioned as an opportunity to make strategic connections across executive branch and non-executive branch agencies to better serve and improve outcomes for all Wisconsin kids and their families. And the leadership that all of you provide here today from your unique positions across state government enabled us to make those strategic connections that others won't see. And we really take this opportunity seriously because obviously we happen to have a governor who ran on the platform of what's best for our kids is what's best for our state. And so we really think that this is a group of folks who very naturally situate themselves in that orientation, in that lens. At the launch of Leadership Council on Early Years, our state preschool development grant, so sometimes we talk about PDG, that's what this is, the state preschool development grant, it provided us the opportunity to really launch this group and to focus on building a roadmap. It's helped us to secure additional funding to accelerate this work. It's helped us to pierce into some of the ideas that we have around a common child-centered agenda. And it's also helped us to sort of see the opportunities and also examine the challenges around equity, access, affordability, quality, and certainly supporting the workforce for our entire early childhood system. Throughout the years, we've shared how our early care and education system has worked to provide more quality, affordable childcare to families and other essential supports. And the council members who sit at this virtual table have continually shared ways that we could make our system stronger. And most especially, it was the help that this group provided to help us design a project called Project Growth, which supports public and private partnerships related to childcare around the state. That's been just a really wonderful achievement that we could not have achieved without this table. Throughout this work, I've learned so much from each of you and your agencies about how your agency work contributes to strong and thriving communities here in Wisconsin, and how working together we have really, I think, doubled and tripled the impact that we have across the state. Some examples of our shared learning through these meetings over the years have included focuses on economic development and community building, overseeing locally administered programs, equity and data-informed decisions. We learned about how Leadership Council on Early Years agencies provide critical services for families, including the work that family resource centers do across the state, supported, of course, by the Child Abuse and Neglect Prevention Board. Efforts to foster social connectedness of youth, led by the Office of Children's Mental Health, and for refugees like our recent Afghan guests. We learned how to better services to support children and families with disabilities across and through partnerships across DHS, DPI, and DCF to help kids and their families access early intervening services and get young children off to the best possible start. And more recently, we learned how economic benefits such as child tax credits administered by DOR provide an essential foundation for family income. We also had the opportunity to learn about some cutting edge research, including how we can improve economic mobility for all families, shared by our friends at DWD and UW-Madison. These efforts have included really cutting edge things like baby bonds and guaranteed income pilot programs. And so certainly proud of the learning that we do in this group, and also proud of the cross-pollination of ideas. You know, there's so much that happens in this meeting that then gets taken offline, workshopped, and finds their way into really innovative solutions to challenges that we see, awesome partnerships and collaborations. So I'm looking forward to another 4 years so that we can capitalize on some of the momentum that we've created. And of course, in the spirit of partnership, I do want to welcome again our newest Leadership Council on Early Years member, Lieutenant Governor Sarah Rodriguez. I'm really inspired. As I mentioned, we've gotten out on the road several times already to really focus on kids and families issues. And I'm so inspired by the way that she just so naturally connects to her own personal experience her own lived experience in really helping us better understand the opportunities that we have to serve kids and families in the state of Wisconsin. She, just like the rest of us, is super excited about this budget in particular, kids and families budget. And she understands just how important all of the systems that we administer are to helping to create the best possible supportive system for kids and families. I've had the opportunity to travel with her. We've been in Waukesha, Wausau, Rhinelander, Marinette, Superior, and just yesterday we joined Secretary Pahacek and Deputy Secretary of DHS, Deb Standridge, as well as some early care and education professionals from across the city of Milwaukee to talk about cross-cutting investments and impact. And I just couldn't have been more proud yesterday to just be in a room where my colleagues and I were so effortlessly able to connect those dots for kids and families. It's not AstroTurf. It's not just a bunch of theoretical ideas. It's work that we're doing every single day. And it feels very cool to be able to say that. As I said yesterday, it was just one of those pinch me moments to really feel like we were doing what we said that we wanted to do, which is to really squarely focus on kids and families and connect those dots. So, Lieutenant Governor, I welcome you, and I want to cede the floor to you.
So thank you so much for having me here. This is fantastic. And I want to tell you what my favorite thing about a snow day is as well, which is when I was little, we had tons of snow and we used to tunnel in the yard, and my siblings and I would have a spotter for, cave-ins in the tunnels. So we would tunnel all the way through, and that was the biggest fun that we used to ever have. But anyway, just wanted to make sure that you were aware that I also love snow. And thank you for your introduction. I'm really excited about being here in this meeting and working together really to advance the governor's vision for what it means to have really healthy and, having Wisconsin kids and families thrive. So in my role as Lieutenant Governor, I am going to be partnering with Governor Evers and all of you to look across whether it's the departments, whether it's the executive branch, and how we can use government in service for our kids. And some of you know my background a little bit. I've met with many of you already. I'm a public health nurse. That's what I did for the vast majority of my career. And that's really the lens that I look at when I look at kind of the work that we're going to do as we move forward. And we really want to be able to invest in our kids and our communities and prevention. And as somebody who's worked in public health, that is the most cost-effective thing that we can do, is make an investment in those kids. And because I'm a clinician as well, I'm a nurse, and I've worked with it as a nurse for many, many years. I've said this before, and I'm going to say it again. The medicine we give people, the procedures that we do, it is such a tiny fraction of how healthy we are. It is about where we live, the air we breathe, the water we drink, and whether we've got a good paying job to put food on the table and to pay for those medications. And I would also add whether we also have good, solid, quality, reliable childcare. These are the things that are critical for folks to be able to thrive in our communities. And with that public health lens as well, our children's health and well-being are so critical. It doesn't just stop at prenatal care, well child checkups, immunizations, all of those things are really, really critical and necessary services that we need to be providing. And those good paying jobs that we have out there, that's also a prevention method. That's also a way that we can make sure that our families stay healthy. Reliable transportation, stable housing, affordable health care, all of those childcare options that we need with strong public schools. So I'm a mom of two. They're a little older now. They're 13 and 16. And so they do a little bit of sighing and eye rolling in my house at the moment. But I do remember when they were little and having to be able to do that dance with childcare, trying to work full time and then rushing out the door to grab them, making sure that I was getting to work on time and getting to daycare on time. And I can't tell you how grateful I am to the childcare providers that I had when my children were small. I don't think I would have been as successful, or I would have been as focused at work and be able to do what I wanted to do if I didn't know that my children were safe. And so I think that that's such a huge issue too. So really wanting to make sure that I can focus on, prenatal care, maternal support, paid family leave, which is something that really has garnered a lot of interest from the governor's budget, really talking about paid family leave. And I mentioned this yesterday at our meeting. I was very lucky to be able to spend 12 weeks at home with both of my kids after they were born. But I had to save my vacation and my sick time to be able to get a little bit of that paid, but much of it was unpaid. And I was fortunate to be able to do that with a partner that I had. But I was looking at folks who worked within within those organizations, the lowest paid, most vulnerable community members that we have. And sometimes they would come back after 4 weeks. And that just broke my heart. And everybody should have had the opportunity that I did with my children to stay home with their kids for 12 weeks. So I do really appreciate this unique forum, this group that provides for collaboration, shared learning, collective problem solving. We all connect with kids and families in some way in the work that we do. And so I am really excited to work in partnership with Governor Evers and all side of you. And I do see my role as well as shining a light on the really fantastic things that the government is doing and that all of your divisions are doing. So I'm excited to be here. I do want to apologize a little bit that I'm going to have to pump off. I've got another meeting that I've got to run to, but I'm going to be able to make these meetings a priority on my calendar after this. And I just wanted to talk a little bit about those budget priorities that the Governor Evers had put into the budget. What we heard from Wisconsinites, which is really that they want us to increase public funding for our schools and meeting the mental health care of our kids. I don't know if you've seen the recent news about teen girls, having over 60% have had these, feelings of depression and anxiety. And that's something that we really have to deal with. They want to make sure that families have affordable, accessible childcare, healthcare, and then increasing and strengthening our infrastructure, whether that's broadband expansion and transportation infrastructure. And those things affect our kids as well. If we know from the pandemic that many of our schools went virtual, that was a real problem in our rural areas, that kids could not get connected to school because they did not have broadband where they were living, or it wasn't affordable for them to be able to have it in their home. So investing in those workforces and economic development, stable housing, those are good things for our kids as well. And having safe places to play. I mean, that's something that maybe some of us take for granted, but there are places where it is not safe. There are not safe places for kids to play. And we want to make sure that we're prioritizing that as well. So as we'll discussing today, the governor's budget investments in all of those priorities and more, historic investments in education and childcare, to health and mental health, infrastructure, safe, clean water, paid and extended family and medical leave, and really just reducing the tax burden on middle-class families and beyond. And as you said, this budget is a clear articulation of the governor's priorities, which when our kids succeed, we all succeed. What's good for our kids is good for the state. And it's a breakthrough budget. We have a lot of dollars that we have in surplus that we can use in investments right now. And that's the principle that brings us all to the table today, that we can work together to be able to solve many of these problems. And so I just wanted to thank you for having me here. And I am just really looking forward to working with all of you.
All right, thank you so much, Lieutenant Governor. We really appreciate your comments and very excited to get to work with you. All right, before we get into the meat of our agenda, which should go pretty rapid fire around this Zoom room, I realized I forgot to invite a few folks to introduce themselves, and I apologize for that. So Cheryl, we were talking before, Secretary Olson Collins, we were talking before the meeting started, and then I just skipped right over you. Can you introduce yourself, please?
No worries, no worries. I'm Secretary Designee Cheryl Wilson Collins. I'm the heading up the Department of Financial Institutions. And as far as the snow goes, I like to play in it, but I'm with you, Emily. At this point, I like a nice warm blanket with a cup of coffee and like to watch it outside. So thanks.
Perfect. Thank you so much. And Melissa Roberts, I see you on for DOC. Are you representing DOC today?
Yes, good morning. Thank you, Secretary. Unfortunately, Secretary Carr is unable to make it. He is downtown with our friends at the Capitol this morning. So I'm the Assistant Deputy Secretary for the Department of Corrections, so happy to join you. My favorite thing about snow days when I was a kid was definitely building forts. I grew up in Manitowoc. We always got a lot of snow. We would save huge plastic gallon ice cream buckets and build pretty intricate forts with those. What I didn't like was putting my feet in bread bags inside my winter boots before we went outside. But thank you
I love it.
for having me.
Yeah. Thanks, Melissa. I appreciate it. There's so many funny memories that people are bringing back up to me right now. I love it. And then, of course, First Lady Kathy Evers. I need no introduction, but First Lady, would you like to tell us what you like about snow days?
Oh, I enjoyed snow days myself. I can remember sitting in front of the radio at the time, waiting to see if school is called off. It's a little bit different today, but we would just anticipate the potential of having a snow day. And it was always fun to hear that announcement when it finally came out. And I liked playing because we would have I'm close to Manitowoc, so we would have the real high snowbanks too. And we would play King Off the Kingdom, which probably wasn't real safe because a lot of it faced the road, but somehow we were able to do it and had a good time doing that. So I'm glad to be here with all of you today.
All right, thank you so much. Really appreciate that. Did I miss any other agencies or any other agency surrogates while I'm just, before we get into the meet?
Hey, DOT's here. I just had a meeting with Gov's office earlier, so I logged on late.
Okay. Wonderful. Sorry, I missed who that was.
Representing WEDC. I also hopped on a couple minutes late, but Missy's in South Korea, so couldn't be here.
I saw that. Yep. Okay. Thanks, Tracy. And then Jessica, that was you that hopped on right away?
Yeah, that's me. I'm standing in for Ellen. He's in Kenosha today.
All right. Okay, great. Thank you so much. Nice to see both of you. Okay, so let me tell you how this is going to go today. So I'm very, very excited to be able to capitalize on the fact that this budget is very new, right? 1 week old today, and we have the opportunity here to shine a light. As you know, we always record these Zoom meetings. Folks are either watching live on YouTube, but we also record this meeting for posterity's sake. And we really wanted to take this opportunity with the budget so new to be able to really spotlight through that kids and families lens. And there are things in this budget, there is so much to love in this budget, and really wanted the opportunity for folks to speak from that authentic place of, you know, how is your agency really interpreting this budget, the parts of the budget that are that really ignite your spark around kids and families. And so that was kind of the ask, is if folks could take several minutes and just highlight, obviously not everything, but something that you think is really important to remember in this giant document from that kids and families place. And so really wanted to hear from folks. Obviously, if you're not able to do that, or you don't feel like you can speak to that, feel free to pass, no problem there. But we want to make sure to really sort of get our way around the circle. I think this is going to help folks who use this meeting to really understand how agencies do come together and do create that supportive fabric for kids and families. I think this is
and then I will have a bagel with.
Is somebody? Oh, Margaret, I think you need to mute. Okay. So this will be sort of a piece of source material that I think will be really helpful for folks as they think about those pieces of the budget and how they intersect together. So I will kick us off and talk about just a couple of key pieces in the DCF budget that I want to introduce, and then we will go. I think if you will see on your agenda, we've got kind of a tentative list. I think we did omit a few agencies from that list. Very sorry about that. And so I think I've got a kind of a running tick list here, and we'll just go through and see what we can build today in the space. So what I would like to sort of highlight coming into our budget is over the last 4 years, so over term one, DCF is really proud of its track record in helping to keep kids safe. In fact, we were able to keep kids in childcare safer than ever by instituting a more rigorous background check process, and implementing that background check for more than 90,000 staff caring for young children across the state. We were obviously able to institute a landmark program, Child Care Counts, which helped child care providers keep their doors open and care for the more than 275,000 children who are in care. We'll talk more about Child Care Counts as part of this budget. We were literally able to put more money in the hands of parents to help them afford childcare and stay in the workforce and support their families through the combined impact of increasing the child care subsidy program, of course, coupled with the monthly tax credit. We're proud of our efforts to safely transform the child welfare system to dramatically reduce the number of children in out-of-home care. And we also invested in critical stability support so that families could stay together safely in their homes and communities, and access supports like housing and other important needs rather than simply removing those children from their homes. So I'd like to use my time to really focus on one particular aspect of the budget. I'll go through a few things, but I want to just squarely focus on the Child Care Counts program. And how important that is for our families, for our child care providers, and for our state economy. Just to put it in really plain terms, we face a fiscal cliff at the end of 2024. We're aware of all the gains that have been made through the investment in the Child Care Counts program. I think to date it's somewhere in the neighborhood of $524 million. And of course, this system, the efforts that we've made in building this investment, in building the system to administer this investment could unravel if we don't sustain this investment through ongoing funding. So we were, of course, very pleased to see this proposal broadly supported by a wide range of state and local early childhood leaders, as well as the governor. Of course, he understands and we agree that this is an economic development and workforce issue. Without a strong childcare system, families can't work. And if families can't work, employers are not able to keep their doors open, and local economies will begin to falter. So this investment is not just critical for the economy, it's just the right thing to do for families. It's transformative, it's a once in a generation opportunity to fundamentally change and support communities and local economies through that long lasting permanent investment in the Child Care Counts program. So that's huge for us. We can talk more about that, but listening sessions around the state, other groups have really built a strong chorus of folks who are excited about this investment and certainly championing this budget proposal. There are several other budget proposals that are critically important to young families and to DCF. I'll talk just about a couple of them. So obviously, the Partner Up program, which is a program that we workshopped and architected to an extent in this group. But this is a program that helps to support partnerships between businesses that help employees with the cost of childcare. That is a wonderful proposal that we're looking forward to championing throughout this budget. We are looking at ways to reduce the cost of Wisconsin shares by waiving co-payments for families at high poverty levels. That's a wonderful proposal. And then continuing to develop and invest in an early childhood infant mental health infrastructure and the supports around those so that families have access to early care providers and supports that build strong social and emotional assets for young children. And then finally, supporting efforts to migrate the child care provider licensing application process to an electronic one. Now, certainly there are more efforts across the DCF budget that have impacts on kids and families. Child care is one part of our agency, but we are also obviously the child welfare agency, and very excited in proposals that build on and strengthen efforts to provide an array of supports that keep families together in communities and avoid out-of-home care placements. We are supporting increasing relative placement for children in out-of-home care, so kinship care, and supporting improvements in the child welfare data and information system capacity. And then over in our child support program, we're continuing our efforts through this budget in our child support modernization project. So very similar to our unemployment infrastructure that needs an overhaul, or that is experiencing an overhaul. Our child support infrastructure also needs that same IT update, that same IT modernization. So investing in that, investing in increasing funding for our W-2 benefits program to help eligible families access critical supports, and then looking at additional investments in our emergency assistance program for W-2 participants. So I'm very excited to be able to champion a budget that feels, again, so squarely focused on kids and families. Obviously, such important and significant investments coming out of the DCF portion of that budget. Before I go over our list, I was asked by our colleague Missy Hughes from WEDC to talk just a little bit about the WEDC portion of the budget. And Tracy, I can certainly ask you to chime in with anything else that you'd like to note here. But Missy asked me to share that WEDC is looking to secure flexible funding in our block grant to allow us to continue to support innovative solutions to childcare. And in addition, as they plan their economic summit in the fall, they are planning to highlight and celebrate businesses that are at the table with solutions, working with government, NGOs, and other partners, which we are very excited about. Tracy, anything else you want to bring up from WEDC perspective?
No, thank you. That was great.
Great, thank you so much. So with that, we are going to go, as I said, sort of rapid fire around the Zoom room, and folks are welcome to highlight something that they're authentically excited about from the budget. Obviously, we're really interested in surfacing the proposals from your agency, but you know, feel free to just be authentic in that space. And again, if you're not prepared to share today, that's totally fine. But we do want to be able to offer that opportunity to everybody. So I'll start with DOR. Gary, would you like to share?
Yeah, though there's, as you know, DOR doesn't provide any supportive services directly to children. What we do is we provide funding to state and localities through shared revenue, to localities through shared revenue. We also have the lottery proceeds go to property tax relief. Last year, we provided each family with about $213 in tax relief. Our lottery proceeds have been rising this year, so we expect that property relief to increase on a per capita basis. The things, you know, the secretary went around with the governor 2 days ago to Racine, Wausau, and Eau Claire to meet with local officials, particularly police, fire, and EMS, to get a sense of what their budgetary constraints were. As you know, localities haven't had an increase in state revenue in about 10 years. Their budgets are stretched, and they've had to, I think, maybe curtail some services that they would prefer not to. So the trip was successful in the sense that the governor, I think, and the secretary got a better sense of what the challenges were for those localities in terms of their budgets, and certainly are supportive of the governor's efforts to dedicate, I think it's 20% sales tax to shared revenue. So those are the big things for us. You mentioned the other things that are going to benefit families, obviously the child tax credit, the income tax deduction, increase in earned income tax credit. All of those things, I think, are going to give families the resources that they need to either pay for childcare or provide, health support and services to their children. So that's it from DOR.
Perfect. Thank you so much, Gary. I really appreciate that. All right, we will head over. I think Secretary Pahacek said that, Jeremy, you're going to provide the update.
Indeed. Good morning, everybody. Hello. Again, I'm Jeremy. I'm the newly appointed Assistant Deputy Secretary here at DWD. Something that didn't get mentioned about snow days was the price of right. I loved watching watching game shows you didn't get to do normally. Learning how much Cascade costs, or watching Plinko. For some reason, that's a strong childhood memory from snow days. And I'm also super excited today to share a couple different components of the governor's budget that are in the DWD space that we think are really have a tremendous impact on how we can better drive early childhood success. Two things I want to highlight. The first is the Workforce Innovation Grant Program. A little bit of background. In 2021, Governor Evers announced a historic workforce solutions initiative. This was an unprecedented investment of $150 million in Rescue Plan Act funding to help drive successful solutions to address the post-pandemic workforce needs of Wisconsin. The centerpiece of that was a $128 million program called the Workforce Innovation Grants, WIG, colloquially in our organization, which is a strong collaboration between DWD and the Wisconsin Economic Development Corporation. The way these grants function is they provide up to $10 million to innovative regional strategies that work to address the workforce challenges, both created and exacerbated by the pandemic. Clearly, we know that the early childhood education space hits us in two different areas. Certainly know that access to high quality, affordable childcare is a key workforce barrier for many families in our state. And we also know that the workforce within those environments are unique and special and require additional supports to be successful and ensure that we have a strong pipeline of professionals throughout our communities to help provide care for Wisconsin's children. And so I'm excited that through the WIG grant program, we were able to support 6 different projects across the state. This represents more than $24 million of the WIG funding dedicated to, again, solutions around early childhood. All told, it accounts to more than 1 of every $5 the WIG grant program. Some examples of these include improvements to childcare facilities in Door County and also in Greene County, creation of housing and transportation projects within Milwaukee to really address and support the ECE workforce, as well as additional preparation programs for ECE professionals throughout the state. Something that's really exciting, again, about the governor's budget is that it will provide an additional $200 million to the WIG program, which again will allow us to further expand the amount of resources we're able to dedicate to such innovative solutions that are really working at the nexus between early childhood and workforce concerns within our state. And the second item I really want to talk about today is FMLA. I think the Lieutenant Governor did a fantastic job both today, speaking from a personal perspective and the importance of access to family and medical leave, how impactful it is to families with small children, mine included, in terms of what a tremendous resource it is. There are 2 components of within this budget that I really want to highlight today. So first is an expansion around the existing Federal Family and Medical Leave Act to include some additional provisions. One, including increased opportunities for leave to be taken to care for a grandparent, a grandchild, or siblings with serious health conditions. It will allow us to expand a qualifying exigency. So essentially to allow for leave if there's a deployment of a child or your spouse, or if your childcare facility closed or there's an unexpected school closure. Additional components, expansion of the definition of serious health concern to include medical quarantine, and some statistical difference as well. It will reduce the number of qualifying hours an employee needs to qualify from 1,000 down to 680, and will also extend the status limitations for filing a complaint from 300 days all the way down to 30. Again, we know how important the current unpaid system is as a supportive resource to families as they're, ensuring that they can take care of the people in their lives that are most important to them. But we also know that it's an unpaid program and that for many working families, they are unable to take full benefit simply because they cannot afford, from a household budget standpoint, to have 12 weeks of unpaid time. So, and again, I think one of the most exciting things coming out of this budget session is going to be the proposed creation of a paid FMLA program within Wisconsin. Again, we know how important this leave is to families, and we're excited to see that it will provide additional resources so that people can fully take advantage and really not have to make really difficult choices between supporting their family to the best of their ability and be able to pay their bills. So again, there's myriad other intersection points between DWD, ECE within the context of the budget, but those are two items I'm personally really excited about.
Awesome. Thank you so much, Jeremy. Amy told me you were a fast talker, and now I see why. You did a great job. Thank you. All right, let's go over to Julie from DNR.
Hi, everyone. Yeah, I'll try to keep up with what Jeremy just presented, but I am excited to highlight a couple of things in the governor's budget, but I actually wanted to frame that first with talking a little bit about my new position so people are familiar. I started with the DNR recently in November, and it's a brand new position. So I'm the first policy advisor in Wisconsin whose position is dedicated solely to the work in environmental justice. And I know everyone in this room is very excited about environmental justice because really what it is holistic equity. And so I'm bringing that up here today because through this new position and the lens that I'm bringing, and those of you who are familiar with my work at DCF and DPI know that I'm bringing a strong lens of thriving communities for children and families. DNR will be more easily making the connection between how our work contributes to the health, safety, and well-being of families in Wisconsin. So links, environmental justice is focused on the disproportionate impacts that marginalized communities have faced, the impacts of environmental harms and risks, and really looking at the cumulative impacts. So just like the disproportionality when we look at child welfare, housing, incarceration, education, when those communities are also disproportionately impacted by environmental harms and risks, there's a cumulative impact there. So through my position and our renewed commitment to environmental justice here at DNR, we'll be looking at those cumulative impacts. How can our policy decision-making be changed in reaction to those factors? But also a strong emphasis on outreach and engagement with communities and collaborating with agencies and community-based organizations for authentic engagement in this decision-making. So, but also making those links between, the work of DNR is making sure that families have access to safe drinking water, safe air, safe places to play, as the Lieutenant Governor pointed out. So some of the budget investment proposals are related directly to that. So the governor's PFAS action plan allows for 2-year funding of over $106 million and 11 positions to implement a statewide PFAS action plan. That includes $100 million for grants to communities to test and remediate contaminated sites. And then also water quality improvement. So the proposal includes $200 million for lead service line replacement And this will supplement a significant boost to those programs through the federal administration's bipartisan infrastructure and a lead line accelerator program, which provides additional technical assistance from EPA. So just as an example, earlier this month, the State Assembly's Black Caucus held a webinar on mental health in Milwaukee, and the Milwaukee Office of Violence Prevention noted that the need for lead line service replacement in Milwaukee is the #1 health disparity issue in Milwaukee. And the reason for that is clear. If we don't have safe drinking water for our kids, if we don't eliminate lead poisoning in our kids' systems, then all of the other work is that much harder for improving the safety and well-being of kids. So that lead line service replacement is really important. The accelerator program at the federal level will help several communities throughout the state. And our focus will also be to ensure that those the lead service lines are being replaced in the communities that need it most, even within Milwaukee. So speaking of safe places to play, we also have, the governor also has some proposals to improve our parks and access to parks. Nearly $3 million to electrify another 450 park campsites. Also nearly $200,000 a year to expand park recreational opportunities for disabled visitors. So I'm really excited about those initiatives and excited about the work of the DNR to support thriving families. Thank you.
Great. Thank you so much, Julie. And thanks for taking an extra minute to help us really understand your position a little bit better. It's so cool. It's such a neat thing. And we're, of course, cheering for you as a DPI and DCF alum. So excited for what you'll do in your role. Awesome. All right, over to Secretary Blumenthal from DOA.
Great. Thank you so much. And hopefully I won't get booted off during this today. Sorry about that earlier. But thanks for the opportunity to provide a little bit of an update from the Department of Administration. There are so many exciting things to talk about. It was hard to narrow it down, but I will talk about 4 key areas, one being the state workforce, 2, affordable housing, 3, healthcare, and clean energy investments. So first off, one of the top priorities at DOA is growing and maintaining a strong and resilient state workforce. So there were so many provisions in the governor's budget to support working families in our state workforce that we're particularly excited about. And looking at it from the state workforce lens, obviously several people have already mentioned the 12-week paid family and medical leave program. And that would be a historic win for workers and families. Paid sick leave for limited term employees or LTEs, faster health insurance premiums. Right now you have to wait 3 full months when you become a state employee, and getting that in the 2nd month, increasing vacation time allotments for employees entering the state workforce between 2 and 4 years. And then of course, there's a lot of pay adjustments and minimum wage increases for lower wage workers and those in really high turnover positions. And finally, the call to restore collective bargaining rights for frontline workers. So a strong and resilient state workforce will help families across the state. And secondly, affordable housing and addressing homelessness is another big priority for both the Evers administration and us here at DOA, where we administer many of the housing and energy stability programs. So the Wisconsin Emergency Rental Assistance Program, you've probably seen commercials on TV if you watch TV, that recently closed to new applicants, but it's been incredibly successful in preventing evictions and improving housing stability for low-income housing throughout the pandemic. We're also keeping some funds in reserve to provide ongoing housing stability services for folks statewide. The governor's proposal also includes a $60 million investment for civil legal aid, which will create a statewide right to counsel in eviction proceedings, giving struggling families and individuals a fighting chance to keep a roof over their heads. We have a $23 million investment in homelessness prevention programs, and as well as $100 million for housing upgrades and renovations and increasing affordable housing options that have been proposed in the governor's breakthrough budget. Thirdly, we stood up two programs during with the American Rescue Plan funds, the Neighborhood Investment Fund and Healthcare Infrastructure Programs. Again, both hugely successful, incredible demand for these programs. And these help access for community needs and help impact children and families with such as childcare and healthcare. And the governor has proposed a combined $250 million in investments in these two programs and making these more of these opportunities available to communities across the state. Our team recently visited one such project that was funded through this program in Wausau, along with Lieutenant Governor Rodriguez, for a ribbon cutting of the Community Partners Campus that brings multiple nonprofits together under one roof to provide meals for school-age children and family, a warming shelter, a free clinic, a diaper bank, a food pantry, and a local CAP agency and county human services. And this is really a model for other communities, providing that one-stop shop for families in need. And we can really make a big impact on communities and children and families across the state looking at this model and trying to replicate that. And then finally, we look as we look to building upon the Clean Energy Plan, which is marking the first year anniversary in April. This will help lower energy costs while improving health outcomes for vulnerable communities and set our state on a path towards sustainability and resilience in the face of climate change. So I'm really optimistic, and these are just a few of the opportunities that we're working on at DOA, and so excited about the governor's budget to fuel not only a strong recovery, but an economy that works for everyone and a focus on our future and our children and families so that they can thrive for generations to come. So thank you so much for this opportunity, Secretary Amundson.
Thank you, Secretary Blumenfeld. That was fantastic. And just again, underscores how much these programs intended to keep families keep families in community together have a cumulative effect on the health and wellness of our kids. So just really appreciative of all of your good work. Okay, going over to Joey, anything you want to add from DVA?
Sorry, working with a brand new computer. Again, Joey Hoey, I'm the Assistant Deputy Secretary at DVA. I've been here all of the week. I spent the last 30 years working for various legislators in the Assembly and Senate. And although we're all together in state government, agencies operate very differently than the legislature does. So all new equipment, new rules and everything. So I'm still a little rusty, apologies. Secretary Designee Bond is excited by how the budget builds on the governor's significant investment of ARPA funds that grew out of the Blue Ribbon Commission on Veteran Opportunity last session. In keeping with the theme of the Year of Mental Health, today I'm just going to quickly highlight the budget proposal to dramatically increase funding and positions to expand the Veterans Outreach and Recovery Program. Not sure if people are familiar with that program, but it provides outreach mental health services and other support to veterans who have mental health conditions or substance use disorders. The program has been shown some great success so far in reducing suicide rate, homelessness, and other disruptions that have terrible effects on families and children. So we're really looking forward to that part of the budget and seeing what we can do. So, and again, that's about all I've got for today.
All right, thank you so much, Joey. Appreciate you being here. All right, we're going to go over to Rebecca Murray.
Hello, Secretary Amundson. Is it okay if I take a couple extra minutes?
Absolutely, of course.
Okay, good. People talk so fast. It's great. And then some that aren't here. I want to start again with, the prevention board, who we are, just because there's some new people and we are odd. So we were established in state statute in 1983. So we're celebrating our 40th year of existence this year. We are governed by a 20-member board that includes designees from many of your agencies. So the governor's office, DCF, DPI, DHS, DOC, and DOJ. We have 4 legislators and then 10 public members that are appointed by the governor. We currently have 2 vacancies. If anyone's interested or somebody, you apply through the governor's office. The Preventions Board vision is for every child in Wisconsin to grow up in a safe, stable, and nurturing environment. We accomplish this by focusing on primary prevention. We have a very scary name that prevents people from going after our funding sometime. But our focus in statute is primary prevention, strengthening families. And we do this by strengthening families and improving community conditions, because families typically know what to do, but sometimes the conditions within the community prevent them from allowing them to be a strong family to raise strong and secure children. So most of our funding in the budget and the governor's budget, which we are very happy to be in there, probably the first time we've ever been in there, was for family resource centers, which are community-based or school-based organizations that serve as welcoming hubs, one-stop shops for any family, universal primary prevention. And this has provided opportunities to strengthen activities or strengthen families. Their activities and programs are typically no or low cost to the participants. They reflect the community and the community's needs. Our core services include providing parenting supports, promoting the 5 domains of child development, providing resources and navigation, developing parent leadership, making sure we have the parent and community voice there is really important, and community engagement. All of the work is strength-based and grounded in the protective factors. Our funding to family resource centers includes flexible funds to help families with those challenges and barriers that come up, that sometimes an extra $200 to cover something makes a big difference. In Secretary Amundson, one of your emails, you talked about who we partner with. If you're okay, we partner with everyone and we welcome everyone. So besides the directors on our board, we recently partnered with DOT to get information on the Celebrate Children license plates out to all the travel centers. We're piloting a partnership with United Healthcare in Milwaukee to build referrals directly on their pregnant, for their pregnant clients and those with small children into the family resource centers. We did a tour of the family resource centers with their maternal unit in Milwaukee. We're forming a real partnership with the Board for People with Developmental Disabilities, another board similar to us, but they're attached to DOA. Really around a public health project in Milwaukee on lead education and prevention, focused on educating parents and providing some lead safe kits. Earlier this week, we were lucky enough to have Julie from DNR present to our staff around environmental justice and hear about her new position. That sparked a lot of conversation. I know Linda's next, Linda Hall. She did a fabulous job at our last quarterly board meeting, presenting on social connectedness, the data in Wisconsin. Really sparked a lot of discussion with our directors, and looking forward to partnerships on that. Right around the corner is April. We won't have another meeting before that. That is Family Strengthening Month. Many of your agencies are partners in that. We have a toolkit out there, social media. Again, nationally, this is known as Child Abuse Neglect Prevention Month. Here in Wisconsin, we're lucky enough for 2 years, Governor Evers has proclaimed it Family Strengthening Month, really changing the conversation on it. We're not about just preventing abuse and neglect. We are about strengthening families. Thank you.
Fantastic. Thank you so much. And thanks again, for this being the first meeting of the second term and always new faces in this group. It's really important that people understand how you can intersect with some of the programs, and certainly the Prevention Board is one of those programs that just helps us galvanize around this work. Thank you so much, Rebecca. Over to you, Linda, from the Office of Children's Mental Health.
Good morning again, everyone. Like Rebecca, because some of you are new, I wanted to just do a minute on our office. our responsibility for the Office of Children's Mental Health, I think we're probably the smallest unit here. There are 4 of us on our team, but we have a big charge, which is to work across all departments to align efforts to improve children's mental health. Another aspect of our responsibilities is to collect data and monitor the well-being of children in Wisconsin, which we do especially through an annual report, but also through fact sheets that we issue bi-monthly. And many of you I know have seen our annual report that we just previewed in January last month. When I look at the budget, very excited. Obviously, with the governor declaring this the year of mental health, we know that we have a chance to be in the forefront. And although the challenges and the youth crisis of mental health has been building for well over a decade, the pandemic has really brought it all to light and has increased people's interest in it. So we are optimistic that we will, there will be some new investments, some of the ones that you talked about, and more to come. I know when our folks at DPI do their report, they're going to talk about comprehensive mental health services, and that is really important. So we have one item in the budget, and it is for staff to help us with a new initiative that we are working on that is really cross-departmental, and what we are currently calling a youth wellness network. We are bringing together people, staff from different departments who work directly with youth. There are many departments, DCF, DPI, DOJ, DOC, who have youth councils. And these people are doing work with youth to help them develop civic leadership skills and to identify for us what we should be doing around children's mental health and these well-being issues. So what we want to do with the Wellness Network is to bring those state staff together to learn from each other, be more effective by sharing resources and trainings and ideas, and then have them identify youth around the state who will become part of a youth council. And at that point, the state partners will actually be support staff to this youth council that we know that we have on our website. We already identify over 200 youth peer-led programs around mental health. So we know there are lots of youth out there leading. We want to bring them together to increase the youth voice around what we should do for mental health. This is an extension of our effort to approach our work through a collective impact strategy, which is to bring everybody together and identify what's the one thing we can do for youth mental health. And Secretary Amundson referred to it earlier. We have a focus on social connectedness of youth. And so we are pursuing that. That is very much tied. An important aspect of that is early childcare. So we're excited about the investments in early childcare, the investments in mental health consultation. Those are very important to us as we look at what kids need for being connected. And then we're adding to that now what we are hearing, not only in Wisconsin, but throughout the country, that youth voice is really important. So we're kind of bringing those two things together and really hoping to begin to create some new civic leaders and more people who will go into the mental health field to fill some of that shortage of mental health providers, especially providers who are culturally sensitive to the kids that are coming up in our state right now. So with that, I think I will, I'll close and then we can move on.
All right, thank you so much. Obviously very, very excited about a new effort that brings youth together across so many of our programs. Thank you for leading the way there, Linda. Okay, we are gonna head over to Curtis at DHS.
Hello, thank you. I guess I got to start with what was one of our big ones, and that is Medicaid expansion. By increasing the federal poverty level from about 100% to 138%, and covering 89,000 people, which about 30,000 are uninsured. We generate, like 39 other states in the nation have $1.6 billion to reinvest in our healthcare system. It is, a significant amount of federal revenue that can do a lot of good for many people. And in addition, 39 other states have taken this revenue. So it's something that it would be very good for our state. I also do want to highlight the concept of how this can help our direct care workforce, our child care workforce. I hear stories all the time on how people have to hold back their ability to work to their full potential because they need to maintain health insurance. And so by even doing this, increasing by this small amount, we can increase the ability for people to work more hours and reach their full potential, and also help with the workforce crisis. I guess the other thing I would highlight in this is that from a business competitive standpoint, other states do have Medicaid expansion, and so it does put businesses at a potential disadvantage when there's an inability for our businesses in our state to have Medicaid as a assistance to provide health insurance for many individuals. So that does bring in about $1.6 billion. That is by far the largest initiative in the budget. Some other initiatives I'd like to highlight is that they're in public health. There is funding for the lead poisoning prevention and response to fund it to the assumption to meet the 3.5 micrograms per deciliter screening. There is funding for the newborn screening program, which screens babies in hospitals for very critical diseases. And then getting specifically to Medicaid, we have community supports program funding and community health worker funding. So I think when we all sit here, we do understand the complexities of navigating the various systems that we have, whether it's between schools, the medical system, home and community-based services, and others. And so these are supports that can help people navigate and maintain health insurance and health care. Also looking at dental has always been a tough issue. It's a tough issue in the private market, but it is also tough for Medicaid. So there is a dental coordinator to work with dentists that accept Medicaid patients and leverage open time slots, open chairs to expand access to dental services for children and adults. One thing I'm very passionate about is what I like to refer to as the ubiquitous access to telehealth. Due to COVID, telehealth has been shown to be a very effective way of delivering care, and Medicaid has expanded significantly to additional sites, and we have we also have an originating fee site. So the site where the individual needing care actually gets a small reimbursement for the costs associated with that. Looking at that, we want to look at expanding services so that this is one I really like. I have kids, so if I have to pick them up for a doctor's appointment, I'm taking off 3 hours of work and going to picking them up and taking them back. With the telehealth, ideally, we could allow schools to set up a telehealth room where the child could go receive their counseling and then go back to the classroom. It's more efficient for the parents. It's more efficient for the children's learning. So we're working on that. And part of that is expanding to pass through the full funding associated with the school-based services benefit that Medicaid covers. Proposing to expand Medicaid postpartum eligibility. We have some of the largest health inequities in our state in regards to births, and expanding to 1 year of full postpartum coverage will be able to give children a good start. And yeah, it's all the benefits of having solid health insurance while you have a young child. We are also looking at reimbursement for doula services. We have there's increases in the budget for autism treatment rates. There's increases for outpatient behavioral health, and there's another increase which is significant to increase primary care physician rates, with the concept that we really want children to get primary care instead of having to go to the ER or the hospital as their first place to access the healthcare system. And then some other initiatives in Birth to 3, we have expansion of Birth to 3 to the lead levels. So if there is a child that tests positive for lead, they can automatically get into Birth to 3. And then we have for food share, we have the Double Up Food Bucks program, where you can use your food share, and if you're purchasing healthy food, you'll be an incentive for your food share benefit. And then we have some other in the behavioral health area. We have school-based mental health consultation pilot program. We are also looking at psychiatric residential treatment facility grant program. This is really to make sure that we can serve children with complex needs in our state and not have to send them out of state. And then also youth crisis stabilization facility funding. So those are the highlights. There's also many, many more great initiatives that the governor has put in his budget to support children and families. So, thanks.
Thank you, Curtis. I appreciate such a giant report out from such a giant agency. So much work that you guys do in the kids and family space, and it just cuts across so many critical areas. So none more important than Medicaid expansion, obviously. It would unlock so many tools for the rest of state government. So thanks so much for that. And I think we are going to head over to Yui from DPI.
Thank you, Secretary Amundsen. So it's lots of dot connecting today. So thanks for providing that opportunity for us, Secretary Amundsen. First and foremost, we're focused on sustainable spending authority for schools we proposed, and the governor also recommended, similar to Child Care Accounts program that Secretary Amundsen shared with us earlier. We at DPI wholeheartedly support. Schools were funded through the pandemic with a one-time federal funding. As the money falls away, we face a real crisis in sustainability, one that has complicated and already challenging funding landscape. The other piece is increased spending authority allows districts to solidify their plans to serve families and communities. It sets them on stable ground to address the many issues they face coming out of the pandemic. And it gives them the clear signal to use their federal dollars in innovative and impactful ways. And not far behind is the sizable investment in special education. Far too long, we have shortchanged this legal obligation to the detriment of our learners. So this investment will raise all boats and allow our districts to address critical shortage, including those who should be served before school age. So finally, all the things that fall outside of DPI's budget, but align with our overall goals. So funding for childcare strong to ensure educators who are still predominantly female can access care and stay working. Paid family leave to help our educators who again are predominantly female, feel comfortable building a life and family without sacrificing their careers. And the adoption of free care rule for Medicaid to ensure schools can be an active partner in getting kids and their families access to mental health services that we all spoke about today. So trying to keep it as short, Secretary Amundsen, we'll kick it back to you.
All right, perfect. Thank you so much, Yui. I want to ask Cheryl, anything you want to talk about from DFI?
Sure, thank you, Secretary Amundsen. I just want to start by saying we all know the governor's dedication of the Wisconsinites. And it's amazing. And when you hear all the different budget initiatives just thrown out in one meeting like this, it's impressive. But I also want to say I've been really, I've learned a lot about all of what you are all doing and the passion that comes out and how much you all care. So it's pretty impressive. So as Secretary Evans said, I'm with the Department of Financial Institutions. And the current governor's budget includes an increase in spending authority for DFI to help restore the department's cuts we've had over the past 10 years. By restoring our budget, it allows the agency to continue to provide programs that help teachers learn about financial literacy and promote financial literacy and inclusion in the schools and workforce. 2, student debt help. DFI has been offering information and workshops on student debt by partnering with experts on the subject. In the past year, we've had several student loan debt relief workshops that were well attended by families throughout Wisconsin virtually at times that were convenient for everyone. And information and help for families to increase their savings. Working with other organizations and Wisconsin employers, DFI has been helping employees to save automatically through payroll. We are generally working with our partners. We don't have a staff to do a whole lot in our specific area. And then saving for higher education. DFI manages, educates, and promotes Wisconsin college savings programs. And we do have 2 initiatives that are new in the budget. The first is the creation of a retirement savings program for employees of small businesses who are not offered a retirement savings program through their employer. And this provides startup funding of 2 million GPR. Again, we look at the comprehensive financial health of people in our state. And the other one is very, very important. I think the implementation and administration of a qualified achieving a better life experience, or you may have heard the acronym for ABLE. It's a program that either directly or by entering into an agreement with another state or an alliance of states, the program provides tax-exempt savings accounts to pay qualified expenses for an individual with disabilities, including education, housing, and transportation costs. So that's all I have right now, Secretary Amundson. Thank you so much.
Thank you so much, Secretary Olson Collins. Really appreciate, just like you, I'm learning so much and really appreciate folks' ability to kind of see through that lens. So thank you. And then Jessica Bowling from WIDA, do you have anything you want to add from a WIDA perspective?
Yes, thank you. So WIDA is in strong support of the governor's proposed item concerning affordable housing. I've heard many of you talk about the importance of having housing and making sure it's affordable so you're able to have a safe, secure spot for your children, but then also be able to use your funds to be able to support the needs of your children. So part of what is driving up, part of the problem with affordable housing is their lack of affordable housing units on the supply side. So we're currently in the midst of an affordable housing crisis shortage with a shortage of more than 120,000 rental units, according to the National Low Income Housing Coalition. Our fastest growing counties such as Dane, Brown, and Waukesha have collectively underproduced 15,000 units in the past decade, driving up the cost of rent. So our average rent, fair market rent in Wisconsin is $965 per month, which may not seem like a lot to some of us, but that's actually a lot. And many of the renters end up being rent burned in. So what we look to do at WIDA and what we're looking at in the governor's budget is the expansion of our state housing tax credits, which allows us to produce more rental units each year. We're looking at raising the governor's budget is proposing the raising limit from 42 million to 100 million in state tax credits, state housing tax credits. And then increasing the state housing tax credit to 10 million each year for a period of 10 years will result in approximately 1,000 additional housing units each year, with an overall increase of 13,830 in 10 years. And so that will help produce the affordable housing units. There's many issues why that's become an issue, why it's been hard to be able to create housing related to the cost of construction and development of that. And so this will help make more affordable housing units in Wisconsin. And the second budget item that we are supporting is the increase of the proposal to invest 100 million in revised and more robust workforce housing rehabilitation loan program. Let's see, Wisconsin's aging housing, we have about, of 60% of existing single family homes in Wisconsin are built before 1980. And the aging housing stock makes it so there's not a availability of affordable homes to buy or live in. And so this investment would allow for more stabilized communities and neighborhoods and stabilizing prices in neighborhoods and provide safer housing and access for families and children in Wisconsin. Thank you.
All right, thank you so much. Thanks, Jessica. You know, I had a little kind of crib sheet here around some of the proposals that were they not mentioned that I should, you know, sort of connect those dots. And I just have to say, I am so bowled over by the sort of comprehensive vision that were put forth by members of this council today in terms of how we see the landscape and the possibility of these budget proposals impacting kids and families. You know, from clean water to lead remediation to paid family leave to you know, dental health care and some of the awesome recommendations focused on in the Governor's Health Equity Council report that just came out, you know, job training and economic development and access to affordable housing. You know, all of these things in cumulative sum total have an impact on strong families and strong kids. And so just the ability for this group to sort of fully understand that, and the luxury of being able to be with all of you for an hour and have you paint that picture around the agencies to be able to highlight some particular proposals that will do just that, that will strengthen kids and their families is just like, it feels very luxurious to me. And I feel like I'm kind of basking in the promise of what we can accomplish together. So it's just a really powerful statement. This budget is absolutely a powerful statement, but to be able to speak our way around it a little bit through that lens of kids and families was particularly powerful for me and really achieved, I think, the goal that we set out for this meeting, which is to help people kind of understand how these cross-cutting opportunities kind of build together and create a stronger fabric than any one of our agencies working by themselves. So I really want to thank all of you for coming today with those really exciting budget proposals on the tips of your tongues. We are committed today to developing kind of a summary document. Obviously, the budget in brief and all of the great materials that we've received over the last week are very helpful. I think today we're going to be trying to remix yet again and sort of help the members of this council, you know, with a document that is a summation of what we heard today. Obviously, we are all going to be out on the road. If you heard something today that is interesting to you and you think, oh my gosh, I should really reach out to, you know, this agency and we could set up a joint visit. That's some of the work that we're really hoping comes out of this council is, you know, those natural connections, those places where we're intersecting in the space. Linda, I saw in the chat, you know, you said if there are other folks that have councils that I need to know about, you know, to be able to connect in and naturally stitch in. Fantastic. It's those kinds of organic connections that that really are the part and parcel of this council. So suffice to say, on this very cold day, I'm very excited by everything that I heard, and we'll just keep championing this wonderful breakthrough budget. I also want to say we have strong alliances and partnerships outside of government entities. You know, this is sort of our inside government group where we talk about kids and families. There is a group that that Superintendent Underly and I chair on the outside of government called the Governor's Early Childhood Advisory Council. Some of you have membership in that group as well. They also make recommendations to Governor Evers, and at the end of last year, the Early Childhood Advisory Council lent their collective voice as a group of experts in that early care and education field to really throw their full support behind ongoing funding for Child Care Counts. They also recommended as part of their recommendations to him, more supports for home visiting and infant mental health, as well as infrastructure and supports for family resource centers. And so those are all three proposals that are important and that certainly provide that sort of concert to what we've already heard here today. And our tech is just a little bit slow in coming behind me on that one, but that's fine. So 3 really strong recommendations, all in strong concert with where we are headed in this budget. As we close out today's discussion, I do want to provide just 1 or 2 updates about some timely things. I want to announce that just on Monday, we announced a 3rd round of the Dream Up grant opportunity program through DCF. As a reminder, Dream Up is supporting local collaborative community-based approaches that support teams of community stakeholders to evaluate, plan, sustain, and expand childcare and support new childcare programs. So it's really when you think about collective impact, it's really a collective impact model to bring sort of natural community partners together to plan through their existing childcare challenges and then find the opportunities in that. So 3rd round just released on Monday. Your agency's communication directors are going to be receiving more information about how you can help us spread the word about this community-based program. So want to thank you in advance for helping us spread the word there. In addition, we are really excited to announce another round of the Partner Up grant application that will be announced soon. We don't have a exact date yet, but it's coming right up. And this is really truly in thanks to our partnership with DWD and their Quest grant that have made another round possible. So again, it's just another example of the awesome partnerships and collaborations that we can find when we take the time to sit at this table together and sort of understand how where those natural places of collaboration are. So thanks to our friends at DWD, we are going to be running that program again, the Partner Up Grant program. We will get you an opening date on that too. This has been awesome. It's been a great discussion. It always is. I want to thank all of you for continuing to find ways to support each other's priorities as we focus on kids and families. It's just such a passionate group. It's based and rooted in partnership, and it's really one of my favorite meetings to run. So thank you so much for taking the time today. Our next meeting, we are proposing a June 1st meeting that will hopefully get us near through the budget process, and we can all really take maybe an exhale by June 1st and think about where we're at, and hopefully think about signing a really strong transformative budget. So thanks, folks. Have a wonderful rest of your snowy day. Stay safe, and try not to go outside if you don't have to. So take care, everybody. Have a good one.